Hello, I'm Dr. John Sirota. I am a chiropractor in White Plains, New York, and in Wilton, Connecticut. I've been practicing since 1990. It's going on 36 years. I thoroughly enjoy it. Uh, I want to talk today about the importance of a proper diagnosis. I know to some this may sound banal, but it is extremely important to be properly diagnosed. A few examples come to mind. The first is a patient who came to me many years ago, and this patient was told that she had deteriorating discs in her neck, and she was suffering from excruciating neck pain. There was pain radiating to her arms and her extremities, and her left extremity in particular. She was about 40, a mother of 2 or 3 kids, I recall. And I saw her in my Stanford office at the time. Now, the history of this person was that she was suffering from chronic neck problems. She used to go to the emergency room frequently, every Friday, it seemed, for a injection of a drug that's very powerful. It's a narcotic. It's called Dilaudid, and it's in the same family as morphine. Now, she came to me and she was frightened about getting adjusted. She didn't know what would happen to her. She was scared, but she was so desperate because this has been going on for 4 years. And when I asked her what the doctors have said as part of my intake in the consultation, which is what we do on every patient, she said that she's been going for years to this pain management doctor who writes prescriptions so she can manage her pain, and then sometimes he's not there and it's a Friday and she has no choice but to go to the urgent care, or in her case she would end up at the Tully Center in Stanford, and she would go to the emergency room and they would give her Dilaudid. This is going on for many years. Oh, I recall her telling me actually now that she had stenosis in her neck, and the odd thing about a 40-year-old being told that she has stenosis is that it's really not very likely that a 40-year-old has stenosis unless she has such a trauma in her history of multiple neck injuries, multiple car accidents. I mean, it's possible. It's just not really likely. It's more of a diagnosis of someone that's 60. Excuse me. In any case, this patient was getting adjusted. I got her on the table, and it didn't seem right to me that that was a proper diagnosis. What actually happened in her case was I re-diagnosed her with a proper diagnosis of cervical spine radiculopathy, which means that she has multiple herniated discs in her neck. Those discs were encroaching upon the nerves in her neck, and it wasn't in a stenotic fashion. It wasn't cervical stenosis that she had. She had a cervical radiculopathy, multiple cervical disc herniations, and it presented as left upper extremity pain, numbness and tingling in her left arm, pain in her neck, stiffness in her neck, spasms in her neck, inability to move her neck throughout a normal range of motion without pain. And I was excited to get her adjusted for the first time. Well, this was crazy. I got her on the table. She was laying supine, which is face up. The look on her face was incredible. She had an anticipatory look on her face, but she was kind of scared. And I said, look, all I'm going to do is find things that are supposed to be moving, but are not moving, and I'm going to encourage them to move, and it's not going to hurt. Well, I gave her adjustment of her cervical spine, and it was explosive. I mean, we heard there are 7 vertebrae. We must have heard all 5 move in one shot. It was like, and her reaction was priceless. She initially scared me. She started to cry until I realized it was cries of happiness. It was a relief. And she went on for 2 or 3 minutes, and her whole life changed from that point forward. The neck pain went away after 2 or 3 visits. She never went back to the hospital for another Dilaudid shot. She went to the doctor, who told her not to go to a chiropractor and scared her and gave her misinformation. And that's the importance of a proper diagnosis. It can change your life. It can alter your life if you put so much credence into one doctor's diagnosis. Always get a second diagnosis, always get a follow-up when something is so severe that it's incapacitating your life in every way. You can't rely on one doctor's opinion, and sometimes you can't rely on a chiropractor's opinion. Any doctor, any person who has such a profound um, impact on your life. So the importance of a diagnosis is not just an understanding of what's going on in your neck. The definition of a diagnosis is the highest level of understanding. So with more and more information that she presented to me through questioning and her history and my examination of her, it didn't seem like she had stenosis. She didn't have a history of stenosis. She had exactly what I thought she had. And we adjusted her, and through a proper diagnosis, she was able to go forward and live her life happily. She came in once in a while for maintenance care. She never had that visit to the hospital again. She was able to return to all of the activities that she was told not to do as a young 40-year-old female. So this is extremely important, that if you know someone who is basically dropping out of life because of a diagnosis, some doctor somewhere, whatever that specialist could be. It could be a chiropractor that told her, you know, you could never do this again as long as you live. You're never going to walk again as long as you live. That's hard to take. I mean, sometimes they really extend themselves, and doctors really go out on a limb, and they're not really thinking so much about the impact that it's going to have on your life. It could make or break you. I'm Dr. John Sirota here in Wilton, Connecticut, and in White Plains, New York. And if there's something you're going through that's similar to this story, please reach out. Give me a call. Let's take a look and see if what you were told is the diagnosis of what you have actually is what you have. There's many times that it's not, and it's really important to follow up, especially if you're feeling down and you're depressed and you're not doing the things that you love. Have a great day, and reach out if you have any further questions. I hope you enjoyed this video. Thank you.